Good morning, everyone. This is Taylor and Kendra with Gamble Communications. We are going to get started here in a few minutes. As you're tuning in, make sure to utilize the chat feature to ask any questions you have along the way. Thank you again for being here.
Good morning, and thank you for joining us today. My name is Dr. Libby Saunier, and I'm the Executive Director of the Louisiana Policy Institute for Children. As an independent source of data, research, and pertinent information for policymakers, the Louisiana Policy Institute for Children works to shed light on the state of early care and education in Louisiana. Alongside our partners, the Policy Institute has been conducting a series of surveys on the state of child care in Louisiana during the COVID-19 pandemic. This effort has culminated with the release of our latest research on the path to recovery, the evolving impacts of COVID-19 on Louisiana child care providers. This report is especially important in the wake of Hurricane Ida and the recent surge in COVID, as our state continues to grapple with the nationwide child care shortage. I'm thrilled you all are here today to hear from our panelists as they share the top 5 takeaways and insights from the September 29th to October 19th survey that we conducted. Before I introduce our moderator for today's press conference, I want to take a moment to thank our partners who have made this work possible in every way. Agenda for Children, the Child Care Association of Louisiana, Child Care Connections for Northeast Louisiana, the Louisiana Association of United Ways, Northwest State University, On Track by 5 Alliance, Point Coupé Early Childhood Coalition, United Way of Southeast Louisiana, and Volunteers of America. At this time, it's my honor to introduce today's moderator, Sarah Berthelot, President and CEO of the Louisiana Association of United Ways. Sarah has worked in the nonprofit sector for over 2 decades and has dedicated her career to advocating for all Louisianans. Thank you today, Sarah, for leading this conversation.
Good morning, and thank you for that introduction. Let's see. Thank you, Libby, and thank you to the entire Policy Institute team for your consistent research and advocacy work, especially amid the difficulties of the past few years. It is my honor today to serve as moderator for this virtual event as we share findings from the Policy Institute's latest report on the path to recovery, the evolving impacts of COVID-19 on Louisiana's child care providers. Throughout today's program, I encourage you to utilize the chat box to share any questions you have. There will be a dedicated time at the end of the event for a question and answer session where we will attempt to answer all of your questions. With that, it is my pleasure to now welcome our first panelist, Tessa Holloway, founder and owner of Kids Carousel Early Learning Center, which has locations in Baton Rouge, Mandeville, Prairieville, and Zachary, Louisiana. Welcome, Tessa.
Thank you, Ms. Sarah, and thank everyone that has contributed to this research. To provide a bit of background on the state of Louisiana when the survey was conducted, at the time of the survey, Louisiana was facing the 4th wave of COVID-19, over a year and a half into the pandemic, which we now know we are in a 5th wave of COVID-19. Additionally, Hurricane Ida had recently struck Louisiana, and many child care providers were still recovering for that, as well as dealing with COVID. When analyzing the data, we can see that COVID-19 continues to impact the providers, and in 2021, only 1 out of every 3 providers reported not having to temporarily close classrooms or the entire center because of a potential or confirmed case of COVID-19. Almost half of the providers had to temporarily close classrooms in 2021 because of a potential or confirmed case of COVID-19, and 31% of us had to temporarily close the entire center. On average in 2021, providers had to close classrooms at least 3 times and entire centers nearly 2 times. The pandemic continues to affect child care providers and results in closures, and child care providers will continue to face closures since we're now experiencing the Omicron variant. And as I speak to you this morning, I've closed 2 classrooms today before I got on this phone call. So thank y'all for the research. The help is going to be needed. And thank you.
Did y'all hear me introduce Elizabeth? Okay, I'm going to do that again. I was on mute and didn't realize. Okay. Thank you, Tessa. Thank you for sharing. Next, I'm pleased to introduce co-owner and director of Southside Child Development Center in Baton Rouge, Elizabeth Andrew. Elizabeth is also on the board for the Child Care Association of Louisiana. She joins us today to share a second key takeaway from the Policy Institute's research. Thank you.
Thank you for the kind introduction. I'm so grateful to be here today. Insights from the Policy Institute's latest report showcase that child care providers still face operational challenges, but the types of challenges have changed from earlier in the pandemic. For example, providers reported higher rates of staffing challenges in 2021, including 64% experiencing employee absences, 55% hiring or trying to hire additional staff, and 51% facing increased staffing costs. All of this is consistent with trends seen nationwide. But when comparing responses to operational challenges from previous surveys, while 81% of providers continue to face increased costs for cleaning supplies, less than half of providers had trouble obtaining those needed supplies. While these operational challenges have shifted in nature from the start of the pandemic, they continue to persist, which illustrates that things have not yet gone back to normal.
Thank you, Elizabeth. It is so helpful to see how these challenges continue to evolve with the changing climate. Next, please join me in welcoming Antoinette Horde, Chief Operating Officer at the Children's Coalition in Northeast Louisiana.
Thank you, Sarah, for the introduction. So whether you're joining us here from Louisiana or far, thank you for being with us today and the information that will be shared with you today. One more positive takeaway for Fall 21 survey was that the financial strains appear to be easing for Louisiana's child care providers. When comparing Fall 2020 to January 2021, fewer providers reported experiencing financial losses due to COVID-19. However, overall reported loss amounts continue to increase, over 300,000 per center as of October 19, which was translated into about 287 million in a collective losses statewide. Additionally, fewer providers reported having families to be behind on tuition, which for child care providers, this is a great thing. 43% in the fall 2020 compared to 60% here in January 2020. The average amount owed to a center decreased to just over 7,000 from over 16,000 in January 2021. So providers indicated a greater confidence to the ability to continue operations, with 52% expecting they could afford to operate in long-term basis of their current finances and enrollment rates. 1/3 of those providers remain unsure of how long their business could afford to operate, while only 7% predicted their business could last only 6 months or less. This funding shows that the financial support in 2020 slowed dire consequences for providers, while financial support in 2021 appeared to have helped providers move forward toward recovery.
Thank you, Antoinette. We appreciate you sharing these insights today. Next up, Karen Powell with the Louisiana Department of Education will be sharing the fourth key finding.
Thank you for the introduction, Sarah. I'm pleased to be here. The fourth takeaway to note from the Policy Institute's latest survey is that rebounding enrollment rates and relief grants likely contribute to providers' improved financial positions. Almost half of providers served at least the same number of children in fall 2021 as they did in January 2020 before the pandemic. On average, enrollment was just 2% less in fall 2021 than it was in January 2020. At the same time, more providers maintained a wait list in fall 2021 compared to January 2021. And over half reported that being at capacity was a contributing factor for the wait list. This illustrates that families continue to need and rely on childcare. Over 90% of providers received COVID-19 related grants from the Louisiana Department of Education, and a higher rate used the grant funds to offer employee pay incentives. 70% of providers in fall 2021 compared to 58% in January 2021. Providers also use the grant funds for typical operational costs, including utilities, cleaning supplies, and employee wages. One important statistic to note is that nearly half of all providers that received Louisiana Department of Education issued grants used those funds to offset family copays and/or owed balances of families receiving child care assistance. The findings demonstrate how crucial state and federal funding is to help Louisiana child care centers continue to recover from the pandemic and serve young children and families.
Thank you, Karen. It's no surprise to see that Louisiana's child care providers are doing everything they can to support the families they care for. Our final guest today is Jonathan Pierce from the Child Care Association of Louisiana and president of Sugar and Spice Preschools in the Acadiana region. Welcome, Jonathan.
Thank you, Sarah. Thank you, all of the panelists. It's an honor to be included among this great group of early childhood leaders in Louisiana. The final takeaway today to discuss is related to employee compensation, raises, paid time off for early childhood professionals in Louisiana. While many providers offer increased compensation to employees now, raises and paid time off may not be sustainable. Over half of Louisiana providers reported paying a higher average teacher wage in the fall of 2021 than pre-pandemic in January of 2020, with 32% of providers paying at least $12 an hour in the fall of 21, compared to pre-pandemic, which was 22% in January of 2020. Of the providers offering benefits to their employees, the most commonly available benefits were bonus pay, paid vacation, and sick days for full-time staff. The percentage of providers offering bonus pay and paid time off to both full-time and part-time employees increased from January of 2020 to the fall of 21. Nearly 80% of providers continued to pay their staff during COVID-19 related classroom or center closures in the fall of 21. Only 5% of providers did not pay their staff during classroom or center closures during the fall of 21, compared to 25% of providers in January of 21. While those results are encouraging, we know that wages for childcare workers in Louisiana average $9.77 per hour, which is a lot lower than the national average of $12.27. Many Louisiana childcare businesses are struggling to find and retain quality teachers and staff. In order to develop and maintain a robust childcare sector, additional public funding is required to better offset the cost of providing high quality care and education, such as increasing wages for the childcare teachers. Staggering. Thank you guys for such a great study and compiling all these results. Now, I would like to once again thank and welcome Dr. Libby Saunier, Executive Director of the Policy Institute, for some final remarks.
Thank you so much, Jonathan, and thank you, Sarah, and thank you to all the presenters, stakeholders, board members, media members, members of the Policy Institute team, and partners for participating in this important discussion. While enrollment rates increased and financial losses decreased, child care providers are not yet restored to pre-pandemic levels, which still leaves too many families without access to quality care and education for their children. For Louisiana to truly thrive, it must take the steps necessary to ensure all families can access a robust, affordable early care and education system. As we reflect on today's findings, I would be remiss not to recommend the action items that remain necessary to restore early care and education to the level necessary to support Louisiana's full recovery from COVID-19. First, we must continue to use federal stimulus and COVID-19 relief funds to stabilize the child care sector. Child care staff typically earn less than a family supporting wage, and given their pivotal role in keeping our economy running, it's imperative that we provide child care providers grants to support wage enhancements. Next, we must support quality providers as they increase enrollment capacity, whether they are looking to improve and expand their existing facilities or by acquiring additional facilities. We must continue to provide financial support through grants. Lastly, and arguably the most important, we must increase state investment in early care and education to expand access to high quality early care and education, especially for our children birthed through age 3. This will drive economic success for local communities by allowing families to be productive in the workforce and go to school. It will also prepare the next generation of Louisianians for success in both in school and in life. Thank you again to everyone who participated today in today's virtual event. We have an exciting few weeks ahead of us as we share more research and celebrate the inaugural Louisiana Early Ed Month in February. If you have additional questions or would like more information on upcoming events, please email info@policyinstitutela.org. To read the full report and learn more about the work of the Louisiana Policy Institute for Children, visit us at our website at www.policyinstitute.org. Thank you.
Thank you, Libby, and to all the speakers for taking time to join us today and share these critical findings. We will now transition to the chat. Please feel free to ask any question that you have. There was a lot of information covered today. And so if you have a question, please put it in the chat.
I received a direct message that said, child care assistants paying based on enrollment instead of attendance played a major role in providing providers being more financially stable. That changed, unfortunately, on December 31st, 2021. Karen, I'll let you address that.
Thank you. I think that there was a miscommunication by a community partner. We are continuing at the department to pay childcare assistants based on enrollment, and we are not anticipating changing that.
Thank you.
So that was a miscommunication from the field that we did hear about on Monday. We are continuing to pay based on enrollment.
Thank you, Karen. We have a question in the chat from Sabrina LaBeouf. She asked, in what ways do you suggest childcare providers, policymakers expand access to high quality childcare? Can you elaborate on the difference between low and high quality options? So looking at the first question she asked about, what do you suggest policymakers and childcare providers take? What kind of actions to help expand access to quality childcare? Anyone want to comment on that first question?
I'll take the first question and then punt it to, I'm looking at Karen for the second part of that question. I think what we would suggest for childcare providers, policymakers, and just being a citizen of the state of Louisiana is contact your policymakers and let them know, your legislators, your local elected officials, and let them know that you really see that investing in quality childcare is important to you. And how we do that is we have increased investment. If you think about what we spend in our state budget on early care and education, it is less than half of 1%. And what we know is that even our own budgets that we have at home, how we pay our bills, is indicated, importance is indicated by what we make sure gets paid first. And so what we know in Louisiana is that, again, half of 1% of our state budget is put towards young children. And so it's a value proposition. If we say that we're supporting young children and making sure that they have access to quality care and education, we need to increase the state investment to do so. Karen?
Thank you, Libby. And in regard to the second question, Sarah, we know that one of the most critical factors in determining quality in a classroom is really the quality of the interactions between the teacher in that classroom and the children in that classroom, the environment provided in that classroom, and the quality of the instruction and communication provided in that classroom. So in Louisiana, in our unified quality improvement system, we use a tool called CLASS that provides measurement of the quality of those classroom interactions. And that is turned into a performance rating score for each center that can be found on a department website that I'll put into the chat box. And so we know that those sites and classrooms scoring proficient and high proficient and excellent are providing truly high quality interactions and care for young children that really supports their healthy development and prepares them to be excited, happy, persistent learners who can focus in their classrooms and succeed in school and beyond.
Thank you, Karen. And we'll be looking for that link in the chat. Casey Parks asked, and there's a lot of wonderful comments in the chat, so please take a look. Casey Park asked, have you been keeping data on the number of childcare workers who've left the profession this year? We'd like to comment on that.
Sarah,
Go ahead. Yeah, go ahead,
sorry,
Jonathan.
Libby.
Jonathan?
No, you're good. You're good.
The Child Care Association of Louisiana hasn't kept strict and complete data on that. However, we do hear from our members quite a lot, and I can speak from personal experience. Typically, the turnover rate in pre-pandemic in the childcare sector has been extremely high compared to other industries and professions. We're looking at 50% plus, and I know Tessa and Elizabeth can speak to that as well. During pandemic, it has increased significantly. And so without and I personally don't have that data for the state, but I can tell you that the centers that I've spoken to, those numbers have been upwards of 60 to 75%.
Thank you, Jonathan. Any other comments on that question? It's a very good question.
I know the department has worked with University of Virginia to really look at their retention rates. And so I know that that's a piece of data that the department has, and Sarintha just put that the University of Virginia recently published an article showing their turnover on our teachers.
Thank you, Libby. So we have a couple of comments. Mike Johnson says, thank you to each one of you who are taking time to take care of our children. As a member of the legislature, he pledges his support and willingness to assist in any way. So thank you so much, Representative Mike Johnson, for that. We appreciate all of your leadership and support. Sarintha encourages to continue to explore avenues to fund facility expansions. We need expanded facilities and additional facilities to increase access to quality. Our high quality centers are at capacity and have long waiting lists. Thank you for sharing that comment.
I'm going to ask Tessa, if you don't mind, to talk about the micro center that you're helping with in East Baton Rouge Parish related to being able to expand the type of services that you offer.
So we've been working with EBR, and we actually, and I think a lot of the people that are doing the micro centers have already signed contracts for the new year. And most everybody has expanded the amount of children that they could take. I think mine was maybe 117 seats and now it's like 188. But the issue is going to be with Omicron, just like when we started. This is moving so fast and furious that expand, like everybody right now is pretty much just trying to tread water. So the expansion, while it's good, and hopefully when the new school year starts, we will definitely be able to take on more kids, but people are going to have to step up in order to help us, and especially to keep doing the things that we're able to do during while we're getting grants to help. We got a teacher stipend grant, which is allowing to pay teachers a couple more dollars an hour, and that is fantastic when you can get $2-3 per hour more than you are making. But it's going to be that after, like what happens after, and what we need to do to keep the quality of care. You're going to have quality teachers, and to do that and to expand and have more services for the children that really need it, it's going to cost.
And I think that goes to Sorrento Strickland's point to, we need to continue to explore avenues to fund facility expansion, because we really need to expand those facilities and additional facilities to increase our access to quality. Because what we know is that our high quality centers, they're at capacity and they have a long wait list, but they need more facilities. And so anything that we can do to help support that as advocates and policymakers, I think will be beneficial to the field.
Mm-hmm. Thank you. We just want to remind members of the media to drop your email in the chat or reach out to Taylor at gamblepr.com. They're going to be distributing a full report for today's press release, but if you need anything for your coverage, please reach out to Taylor. We have another question on what is considered high quality at this time. In recent history, high quality has been deemed from class scores. However, with such high staff turnover, COVID closures, and quarantine staff and students, new hires with no early education background, centers who have rated as proficient or above proficient struggled to get the high proficiency with all the staffing issues. Would anyone like to comment? Karen, would you like to comment on her question?
Sure, Sarah, thank you. We still measure quality in the state through the class scores, and you see that reflected in those performance rating scores that I mentioned and that I linked to in the chat box. What I think is really remarkable about the last 2 years is that despite really quite significant and overwhelming challenges, we have seen sites continue to improve the quality of the instruction and care in their classrooms. We have continued to see class scores rising, and I think that is just a huge testament to the tenacity and the compassion and the dedication of our early learning centers and their staff.
Thank you. There's a question about CCAP. Will CCAP continue to be paid based on enrollment, not attendance? Is there any documents to confirm this information? Anyone want to comment?
So, yes, I just want to reiterate that was information miscommunicated by a contractor out in the field, and the department is continuing to pay CCAP based on enrollment. That is a change that has been made that is not changing back.
Thank you.
And we have documented that in monthly webinar slides that are available on our website on louisianabelieves.com. And yes, we can share that out again as well.
And Sarah, I see a question about what is a micro centers that Tessa briefly mentioned in EBR. It's an opportunity for child care providers to partner with the local school district in East Baton Rouge School Parish to where the school district has empty classrooms and they are partnering with a local high quality childcare provider to operate a childcare classroom, early care and education classroom inside the school building. But the people that are providing the early care and education are childcare providers. So people like Tessa and others that are working with the school board to do that. So it's really exciting. The Micro Center idea is one that we learned about at the Policy Institute from Tennessee. And it's one of those things that you can do. You could do it within a school district, but let's say a company said, we really want to make sure that we provide quality early care and education to our employees. And if they had the space in their facility, that you could operate a classroom for their employees, but it would still have to follow all the licensure and quality measures to be considered a micro center and for the state to be able to license it as such, as part of an existing childcare provider.
Thank you, Libby. We have a quick question from Janae Lambert. She wants to know if the slides can be shared. So I'm gonna ask that Taylor from Gamble respond to her directly on email. And Libby, for today's press conference, will the Policy Institute share the recording on social media or on your website for access?
It will be in all those places. We will also send up, if you learned about this press conference through our listserv, you will get a copy of the recording and materials there, and we'll have it on our social media as well as our YouTube page.
Thank you. Thank you. So Megan Garrettson shared an article, a UVA article on teacher turnover in Louisiana. You'll find that in the chat. And some other links there. Are there any other questions for our group today?
Sarah, I noticed another question about CCAP in the chat box about some families being dropped if they don't sign into TOTS. And I appreciate that point, because the department is paying based on enrollment, but it's important that your families do continue to sign in to your center, either through TOTS or IVR, whatever method your center uses, because the department is paying based on enrollment as long as children attend at least one day of the month. But we want families to sign in every day that they attend, not just one day of the month, but it is important that we have that information. And if families are not signing in, then the department will be contacting them as part of our underutilization process to determine whether they still need the CCAP assistance or not. So they are not dropped off of CCAP without being contacted first and reached out to first. So just make sure your families are signing in every time they attend. And as long as they sign in at least one day per month, the department will be reimbursing CCAP based on enrollment.
Thank you, Karen. That's some good clarifying information today on CCAP. Any other questions? So just a quick reminder from Kendra Smith-Parks from the Policy Institute to visit their Instagram and to follow them on Instagram. The links will be on their social media page. Any other questions? Well, I want to thank everyone again for your time today. And I think Jonathan Pierce has his hand up. So Jonathan.
So Sarah, I did want to bring up there is a Bessie meeting next Tuesday that I think is a very important one that, I've seen Mike Johnson commented that he's there to help, but anybody else on, it's there will be discussion about an increase in the Child Care Assistance Program funds. And I think it's an important one, and it's certainly a step in the right direction. It's not an end all, but it definitely is a step in the right direction. And any comments at the Bessie meeting would be greatly appreciated and necessary.
Thank you,
Thank you, Jonathan.
Well, since there are no other questions, we just want to thank you all again for participating today. We've had quite a turnout today, and thank you also for the questions and the thoughtful remarks. How we get Louisiana to where we want it to be is through all of you all, for continuing to educate and fight for Louisiana children and families. So again, thank you to all our presenters and to Sarah for moderating today. We can't thank you enough. Y'all have a good day.